happy to be. Feel free to introduce yourself in the chat. We'll be posting things in the chat as well as we go along. And please remain muted until asked to speak. So the host will let you speak. And yeah, I think I'll hand over to Tracy.
Thanks very much. Thanks, Dorothea, for the great introductions, and welcome everyone. Takulandilani to our colleagues from Malawi, especially, who are joining us today for this, I think what's going to be a really interesting session looking at the challenges and complexities around WASH in schools. Again, a thank you to WaterAid for hosting us here. It's nice to come to a new venue as well for one of our forums. So for some of you may be wondering, why is this person from University of Strathclyde hosting and chairing the WASH Forum today? A little bit of background for me. So my professional background is in environmental health. So very much focused on prevention, being better than cure. And of course, core to that in settings like Malawi is looking at water, sanitation and hygiene. And when I talk about hygiene, it's not just about washing our hands. It's also about food hygiene, hygiene of the environment and waste management as well. I was privileged to be based with colleagues at the Malawi University of Business and Applied Sciences. When I was there, it was University of Malawi Polytechnic for 20 years, where I collaborated with a number of the colleagues that are on the call today as well. And we look forward to hearing from them as the day goes on, as well as working with government, third sector, and other private sector partners too, and looking at how we can find solutions to what are seemingly simple challenges, but are really complex in terms of trying to get sustained approaches and solutions that can work for everyone. So with that in mind, I'm absolutely thrilled to spend time today on this specific focus of WASH in schools, and particularly working and hearing for people who are working in dignified partnerships, which of course sits exactly in the core of what the Scotland-Malawi partnership is all about. So turning to our agenda, as Dorothea mentioned, please share who you are and why you're here in the chat so you can get to know one another. We'll hear some short presentations today from colleagues, and we'll have a question and answer session at the end of all of the presentations. That will be an open forum where you can either put questions in the chat we can pick up on, you can raise your hand during that session, and also feel free to share your experiences as well of working in WASH in schools. So the agenda, I think, has been popped into the chat for you all to be able to access if you're online. And there are some paper copies here as well for those of you who are in the room to be able to grab. So to start the meeting, I'm just going to try and set the scene a little with some slides, which I'm looking around because this is not my life.
Okay. Just this slide.
Okay. Well, apparently it could be fine on Zoom, so we'll bash on. All right. So we're looking at WASH in schools, but today we're going to be hearing from myself with Strathclyde a little bit, but then we're going to hear from colleagues across the government in Malawi, WaterAid, and also the WASHTED Centre at the Malawi University of Business and Applied Sciences. Just to remind ourselves what WASH in schools is all about, because sometimes we think it's, you know, there could be a particular focus of an organisation thinking about how they work in water and the provision of water, or particularly in sanitation. But also very importantly, and as we'll see as today goes on as well, one area that we are really lagging behind in is around hygiene, whether that's hygiene of the environment in terms of waste management, but also in terms of hand hygiene and effective hand hygiene around hand washing with soap, to make sure that we're really making that difference. And we want to see improved WASH in schools for a number of things. There's the obvious direct benefits of improving WASH in schools around reducing disease transmission, but also those that are around student health in general. So better mental health and well-being from having those facilities at school, feeling comfortable and safe and having dignity to be able to use those facilities. And all of that good health and well-being obviously increases attendance at school, but also attainment within the school environment as well. But we also have a number of different indirect impacts. So the educational impact of improving outcomes for students, improving gender equity, where girls can attend school through to secondary age as well, because they perhaps have better facilities and access to menstrual hygiene products, for example. We see economic benefits that come out of these elements as well. As school improves, education improves, and opportunities improve. And that trickles also down, which we'll hear from WaterAid today about examples of how that doesn't just benefit the people within the community themselves, but also trickles out, the school itself, but trickles out into the wider community for broader social impact too. And as well as the environmental impacts if we're not practicing open defecation and having contamination of the environment from both that and general waste. For those of you perhaps less familiar with the WASH sector, so I'm hoping that we maybe have some people who are interested in supporting schools today and want to know how they can do WASH better. We measure how we're currently progressing using something called the Joint Monitoring Programme, and that's run by the World Health Organization and UNICEF, and they use data that comes from across every country in the world to see how we're doing in terms of providing a basic service, a limited service, or no service at all. So we're looking to at least have a limited service across some of our facilities, but in an ideal world, at least a basic service that enables people to have safe water to drink, enables them to be able to use sanitation facilities that don't cause ill health, but also provide dignity and safety, and hygiene facilities that have water and soap at them at all times. So how are we doing at the moment? Well, as usual, if we look at the global figures, they tend to look pretty good. 77% with drinking water, 78% coverage with basic sanitation, and 67% around basic hygiene. But of course, that masks the inequalities that are happening across the world. So if we think about many of the global north countries, for example, having near 100% in these figures, as soon as we start breaking that down into looking at low-income countries across the world, so primarily sub-Saharan Africa, we see a different picture, with less than half of schools having access to water and sanitation, and a mere 28%, so less than a third of students having access to water and soap for hand hygiene. And I'm not going to talk about Malawi figures now, because that would be stealing Alexander's thunder when he comes in a moment to talk about the government. So we talk about often transformational WASH in the development sector. There's been a lot of discussion in the last few years about what that really means. And I wanted to capture some of these thoughts, because sometimes we think about WASH solutions, we're only thinking about, well, we need infrastructure to be able to provide the toilets, the water, and the soap, for example. But it's much more complex than that, as colleagues know who work in this sector. A lot of time needs to be spent around advocacy to get funding, to get appropriate planning in place, and have planning for the longevity and sustainability of what we're trying to achieve. That needs capacity building, not only in our students, but also our teachers and other supporting networks and mechanisms on the importance of WASH, and not only those direct benefits, but the indirect benefits for the long term that are worth being invested in. We sometimes drop in solutions that we think look great and are going to work, but they need to be context appropriate. Not only context appropriate for Malawi or a rural versus an urban school, but also for the space within the school at which they're being used. So whether it's before eating a meal, or whether it's next to the toilet, or whether it's just coming out from break when you have a large number of students. And all of that needs behaviour change to be embedded within it, as well, as we'll hear from speakers today. And integration, I think, just to be the last point I want to highlight on here, is so critical. And again, we're going to hear from Natasha today about the importance of integration of WASH with programmes like nutrition and other areas too. So on to our speakers, because you came here to hear from them and not necessarily from me. So we're going to hear from three people today. So Alexander Mwangonde, who is the Chief Sanitation Officer at the Ministry of Water and Sanitation. And Alexander is going to give us an overview of where we are at the moment in terms of WASH in schools in Malawi. And he's also going to share with us what he sees as some of the challenges and opportunities around this space as well. We're going to hear from Natasha Mwenda from the WaterAid office in Malawi to talk about partnerships and progress that they've made already in primary schools and early childhood development centres, with the fantastic work WaterAid's been doing in general, but also in combination with Scottish Government funding. And lastly, we'll hear from Dr. Kondwani Chidziwisano, who's Director of the Centre for Water, Sanitation, Health and Appropriate Technology Development, or more simply, WASHTED at the Malawi University of Business and Applied Sciences, who's going to share some of the research they've been doing and the importance of providing evidence in the solutions that we are looking to develop. So I'm going to stop sharing there, and I'm going to hand over to Kondwani Mwangonde to share your slides, and we can hear about where we are in terms of washing schools in Malawi at the moment. So over to you, Alexander, please.
All right. Thank you so much, Professor Tracy Morse.
Very much.
All right, thank you. Thank you very much. As Professor Tracy has said, my name is Alexander Mwangonde. I work with the Ministry of Water Sanitation as the Chief Sanitation Officer. So my presentation mainly will dwell on the overview of washing schools. I'm not going to take much of your time. I think it's a short presentation. I may take about 10 minutes.
Alexander, sorry to interrupt. If possible, could you put your camera on for the video?
Oh, the camera, all right, okay. All right, thank you. So in Malawi, as an introduction, the wash situation remains very unacceptable. And most of the schools, they don't have adequate sanitation facilities, including water and maybe hand washing facilities. Of course, generally, the picture is that for the schools that have water supply, the coverage is higher as compared to sanitation and hygiene. So sanitation and hygiene, they're generally lagging behind as compared to water supply. All right. So I will first of all start with the enrollment that we have in Malawi. And I will mainly dwell on primary schools because I think we don't have adequate data for secondary schools. So in primary schools for males, the total population, or enrollment is 2.6 million for males and 2.7 million for girls. And for this picture, I think Professor Tracy Morse already presented a service radar on how we monitor washing schools. So as she already explained, I think we are now going to see how the coverage is like in Malawi. So for drinking water, I will start with drinking water. JMP 2023 reports that nationally, I think the coverage is around 92%. And for urban, I think the country was not able to provide adequate data. And for rural, for limited service, we have 8%. And for there's no data for primary school, preschool, which are CBCCs. The country was not able to provide data for that. And 7%, there is no service for 7% in the primary schools. And for secondary schools, we have 84% coverage in terms of safe water. Yeah, sanitation, national coverage is around 74%. And there was no data for urban schools and no data for rural as well as for pre-primary. For primary schools, as compared to secondary school, primary school is higher at 79, and for secondary school is 53%. On hygiene, the coverage is generally too low, and that is always anticipated because from the previous data that we have been having, hygiene coverage has remained low. So for national, we are at 21%, And then there's no data for urban, rural, and the pre-primary. While for no service in the primary school, we're at 51%, 58%, and 59% for secondary schools. We now come to water sources in school. So the figures that I'm providing here, that are just raw data, because I think we are unable for us to quantify in terms of percentage coverage for those kind of services in those primary schools. So I think for this, the highest is boreholes. So most of the schools in the country, they use borehole for drinking water. And the lowest is 9%, which is the schools that are using rake as a source of drinking water. We now go to toilets in primary schools. So these are the absolute numbers, and the measure is having flush toilets, improved toilets, and the basic latrine. So we can, as we can see there, most of the schools generally have improved toilets, and the highest is for girls, which is around 26,295. And we also quantified in terms of the staff in schools, and you can, as you can see there, the figures are much lower as expected. For disability-friendly latrine, as you can see there, we have improved, which is also the highest. So in general, we can say that improved toilets in schools is generally higher as compared to basic for both the actual availability and maybe for those that have provided for disability-friendly ones. And those are just pictures just to depict the facilities that sometimes our arenas use in the schools. So the waste can be the bad one, and for some schools we have some good facilities, as you can see on that picture. So in terms of ratio, yeah, over the years I think we have managed to make an improvement, because for primary schools the ratio as compared to the enrollment in schools. For boys, it's currently at 1 toilet to 64, while the recommended one is 1 to 30. And for girls, we are at 1 to 73, while the recommended one is 1 to 25. So for primary schools, I think we have a long way to meet the recommended ratio of pupils to of toilets to our learners in schools. So as you can see from that table, the coverage for secondary schools is a bit higher. So like, for example, for boys, it's 1 to 32, while the recommended one is 1 to 30. So I think the gap is attainable, and we hope that we may attain that in the near future. And for girls, it's 1 to 27, while the recommended one is 1 to 25. In terms of hygiene, so as you can see from there, most of the schools, they have hand washing facilities that have soap besides them, and they are actually used for that. The other slide is just showing how, as government, we are aligned to our vision 2063. So as government, deliberately, we made sure that we should also tackle issues to do with the school, because we know it's a critical enabler within the vision, and we consider it generally for our economic growth, but also with the focus on education and health, because we know that only healthy learners can concentrate in school, and we also reduce the cost that the burden may be to our health facilities. So deliberately, the government has to include that in our Vision 2063. So what are the key drivers of change and opportunities that we have as government, as a ministry, and the community in general? So as we are aware that there is now a dedicated ministry solely responsible for water and sanitation, unlike in the past when the ministry could be moved to other ministries like agriculture. So the focus couldn't be seen clearly. So this time around, there is that leadership and opportunity that we have a dedicated ministry responsible for water and sanitation. But also we have other documents that assist us to focus our approach on sanitation. Like we have the SADC strategy that provides also an opportunity to this area, which is, the hygiene promotion area, which has always been neglected since time immemorial. But what else is it that the ministry is doing to improve the services both in schools and communities? So the ministry is developing the sanitation and hygiene bill, which is very important, and it will help to regulate provision of sanitation and hygiene both in schools and communities, including the business places and the public places as well. But also, we are also in a process of establishing a regulator solely for water supply and sanitation, because as we are aware that we have a regulator on the water resources, but we don't have one on the water supply and sanitation. So the ministry is in the process of establishing a regulator just to make sure that the intervention in water supply and sanitation are given that focus as much as possible. But also we are developing water supply and sanitation design manuals, which will assist stakeholders maybe to come up with the facilities that are recommended in schools, but also in our community in general. But also in the process of developing the behavior change communication strategy that will also enhance the dissemination of messages to our learners in schools, but also to the community in general. So what are our challenges in general? So much as there have been that progress, but as a country, we're still facing challenges. One of them is the high vandalism of wash facilities, both in schools and in communities, as we're aware that in schools, once we install these facilities, the communities come and they vandalize, steal the spare parts for boreholes, but as well as the spare parts or parts or ingredients for the wash facilities, including sanitation facilities. But also we're grappling with maintaining hygienic standards in schools. Maybe we need also to find a solution on how necessary we may be handling hygiene, because the same learners are supposed to clean the facilities at the same time they're supposed to be in schools. But we also need to see the approaches that can work for us to make sure that the hygienic standards are maintained in our schools. But also we've seen that the finances that are put in the wash sector in schools is generally not adequate as compared to the enrollment, which is always rising year by year. So we also need to have focus and make sure that as the enrollment increases, we also need to have facilities that match the enrollment that's coming every year in our schools. But also there's lack of priorities in schools. There is some school funding that is coming, but little is channeled towards improving sanitation and hygiene, including water supply in schools. Of course, water is a little bit better, but sanitation and hygiene still is lagging. So in terms of recommendations, we generally need high and intensive community involvement. As I alluded to earlier on, the vandalism issue is coming because maybe the community is not taking part in managing these wash facilities in our schools or our activities to make sure that they also take part. But also the issue of behavior change is still a problem. So we should make sure that the behavior change activities are also enhanced, and as we're developing the hardware of the program on WASH, we also need to include behavior change activities for our learners to change behavior and improve their well-being. Thank you so much. That was my presentation.
Thank you so much, Alexander. That was really great, and I think really helped in setting the scene of where we are in Malawi at the moment. So still a long way to go, but progress been made, and it's sometimes nice to reflect a little on the successes that we have had. Well, because often it can be, we have so much to do, but it's great to reflect on some of the successes that have been there. So thank you very much. Feel free to stop sharing the screen now, and then I'm going to call on Chad to help me share the slides for Natasha. So if you have questions related to any of the information or updates that were shared there by Alexander, or you want to know more about some of the work that's in progress there, feel free to put the question into the chat or save it up that we can ask directly. We're now going to hear from Natasha Mwenda from WaterAid in Malawi. Natasha is going to share with us some of the great work, so some of those solutions that have been helping those figures improve that you've seen from Alexander in that previous presentation, particularly focusing around early childhood development centres and primary school work that they've been doing with the programmes in Malawi, hand in hand with government. So I think that should be fine. And over to you, Natasha. Thank you.
Thank you so much, Tracy, and thank you everyone for granting me audience. And I will be sharing the work that we have been doing as WaterAid in Malawi. Next slide, please. So one would be wondering why WASH in schools and ECDs. So for us, we believe that we are contributing to improved public health, especially child health and education outcomes, by fostering sustained culture of hygiene in schools, early childhood development centers, and surrounding communities. The reason we included the surrounding communities because these school children, they live within a community. So whatever is happening at school has an impact even in their communities. And we also believe that by addressing behavior and infrastructure and systemic barriers, there is enhanced hygiene practices leading to reduced disease burden, improved school attendance, and healthier learning environments. Next. So our work, we focus on sustaining adoption of proper hygiene behaviors among learners, teachers, caregivers, and community members. I think from what we have heard from the previous speaker, hygiene indicators are still on the lower side. So our work, we are focusing on hygiene, behavior change. And we also focus on improving access to gender-responsive, inclusive, and sustainable WASH facilities in targeted schools and ECDs, ensuring availability, functionality, and proper maintenance to meet the needs of all users. The reason why we want them to be gender-responsive, because we know that we are also dealing with the girls, adolescent girls, who are usually affected most when we don't have adequate WASH services in schools, because they have some needs, especially during their menstruation, where they need the infrastructure to be available. And we also enhance capacity and commitment of key stakeholders, especially school, local government, community structures, to drive, monitor, and sustain hygiene behavior interventions. So when we talk of hygiene behavior change interventions. It's not just looking at the hygiene as a software issue, but also ensuring that there is the enabling physical environment where the infrastructure is available so that the hygiene behaviors can be practiced. And then we also focus on system strengthening by improving policy and institutional support for sustainable wash services in schools and ECDs, because we know that there is need for guidance in terms of policy and the standards, as well as financing for all these interventions in schools. And that can only happen when you have a functional system, a government functional system. Next, please. Next. So our work, as I have said, we are focusing on system strengthening, ensuring an enabling environment for learning and health. So how are we doing this? We support having a policy environment that is supportive for washing schools. And recently we have supported the government of Malawi to develop WASH standards for early childhood development centers. This was with support from the Scottish government through our Deliver Life 2 project. And I'm happy to also say that these standards are also being used to benchmark the process of developing new standards for WASH in primary schools. And then as WaterAid, we are also supporting strengthening of financing mechanisms for schools. And we are working in rural areas and peri-urban or low-income areas. So we have supported the low-income schools by helping them to pay for water bills, because they are charged a rate that is equivalent to anyone that is operating, or any institution that is operating in the urban setting. And by supporting them with the payment of bills, we know that this is a short-term measure, but we are also engaging with the utility companies to make provisions for subsidizing the rates that the schools pay on the usage of the water that they are using. Next, please. We are also modeling WASH services in schools and early childhood development centers. And we do that by constructing what we call a comprehensive WASH package in schools. Here, I'm just showcasing the kind of latrines that we construct. Let me also be quick to say that these are latrines that can be emptied, so that we don't have a lot of structures at the school. And these structures, we also have a room, others they call it a change room, where adolescent girls can easily use and change if they want to change during their monthly periods. And even for the teachers, we do the same. We provide menstrual hygiene facilities within the latrines. And this is helping to have to ensure that learners have a healthy learning environment, because even in early childhood development centers, we are providing these improved latrines. Next, please. And as an organization, we are also modeling in terms of WASH innovations and technologies, because there are hygiene practices that we want to become a habit amongst our stakeholders, the learners, the caregivers, even the communities at large. So as WaterAid, we partnered with UNICEF to develop a global technical guide for hand washing facilities in public places and institutions. And even in Malawi, we had our own model that we designed and we were piloting, and it is proving to be more sustainable than the buckets or the tippy taps. So in the public places, if we have such a hand washing station as the one that is in the picture, I think it will trigger or it will motivate the people to practice hand washing. And this is also more permanent, which means that the cost that is incurred in the construction, it's a once-off thing. I think the remaining costs are to do with the operation and maintenance, which is very minimal. Next, please. And we also work around menstrual hygiene management, provision of MHM facilities, and the demystifying menstruation amongst learners and teachers through capacity building and mobilization of inclusive hygiene and sanitation clubs in schools. This is in helping us to ensure that there is improved learning experience and learning outcomes for the adolescent girls. Because I think in Malawi, you find that as the learners are going in the higher upper classes, the rates of absenteeism as well as the dropouts starts to increase for the girls. When they are starting school, they may start maybe with more girls than boys, or at the same figures. But then when they are going into upper classes, the numbers start to reduce. And one of the contributing factors is the WASH situation in the schools. So we are trying to also ensure that the girls, they have an enabling environment that they can enjoy learning and have a better experience of learning, for them to also access better education as their male counterparts. Next slide, please. And beyond just modeling, we are also integrating WASH and other areas or other programs. We have been integrating WASH and the nutrition in our work that we are doing in early childhood development centers, where much of the work is to do with the school feeding for the under 5 children, and then also ensuring that they are having an optimal growth. So by ensuring that there is adequate water, sanitation, and hygiene services in those early childhood centers, we're ensuring that there is optimal utilization of the nutrients that they are getting from the school feeding. Because if the WASH situation is compromised in the schools, it means that it will now become a breeding ground for preventable infections such as diarrhea and the other waterborne diseases. So for us, we are working with the ECDs to improve that. Next slide, please. And we also develop hygiene behavior change using our behavior-centered design approach. This is helping us to use motives that will ensure that people are able to adopt good hygiene behavior practices. We use the motivating factors like their aspiration to be hygienic, and not really bringing in the fear that previously has been done, because we have seen that that doesn't work over time. When people get used, they'll stop being afraid of getting infections. But when we are using the motivation factors, that motivates them to practice better hygiene. And our sessions are more interactive and exciting, so that even the children, they can adopt those good hygiene behavior change practices. And all our work is informed by a formative research, so that it is evidence-based. Next slide, please. So this is the end of my presentation. Thank you so much for your attention.
Wonderful. Thank you so much, Natasha. And you would think that we planned this somehow. You know, we just hit all of those, nearly every circle on that image in the introductory slide about looking at sustainability, integration, making sure there's system strengthening, not only the technology, but also the behaviour change. And such an important point there about it not just being a telling off, but making it fun to learn about hygiene and put these practices into place. So thanks very much, Natasha, and I'm sure there'll be lots of questions coming in for you on some of the work that's been going on there. But last but not least, I'm going to hand over to Dr. Kondwani Chidziwisano from the WASHTED Centre at MUBAS to talk to us a bit more about that research. And Natasha finished her presentation perfectly for me, talking about the need for formative research to inform some of these solutions. So handing over to you, Kondwani, to share some of the work that's been going on at WASHTED. Thank you.
All right. Thank you very much, Tracy. Indeed, I will share mainly the work that we have done in relation to research pertaining to school wash. And the research that we are doing here at WASHTED mainly is guided by the national and international documents. For instance, the Sustainable Development Goals, but also what Alexander presented earlier on, the status of our country according to the government. And you would agree with me that as Malawi, I think we are lagging behind quite a lot on sanitation and hygiene from what the government has presented. And most of our research has been aligned towards that. And we have really focused much on issues pertaining to infrastructure, hygiene promotion, but also integration of WASH implementation at school level. So mainly, these are the key issues. So as we are implementing our research, we try to ask ourselves to say, where should we focus our efforts in schools? As implementers, like WaterAid, as government, even as researchers. So should we focus much maybe on issues pertaining to knowledge, provision of knowledge, on WASH, or maybe should we focus much in the provision of hardware, so that maybe we improve access to water, sanitation, and hygiene in schools? But from what we have seen from publications, but also from our own experience, we have seen that the provision of knowledge and the hardware component alone may not really result into the change that we would want to see. So there's more that we need to do. And the research has really proven that, and as government and as implementers, partners to government, may really need to focus on these other elements that I would share more in this presentation. So I should say that we have done various pieces of research as WASHTED, but with our partners across the globe, including here in Malawi. For instance, we were really involved in some research work pertaining to the prevention of COVID-19 pandemic, where we partnered with various partners, including Strathclyde, COVID-19 Hygiene Hub, London School, government as well, and even the schools themselves at local level. And we learned a lot through that process, but I'll just highlight some of the things that we have learned through that process. So during the COVID-19 pandemic, hand hygiene was considered as one of the control measures. And in response to that, government and partners provided a lot of buckets with a tap as a hand washing facility. But as we were carrying out some research, following up on such kind of interventions, we noted that some schools were having a lot of buckets with a tap, like what we can see in this picture here, but they were just being left in the stores. They were not being used. So the facilities were provided, but they were not being used. So it's like a provision of infrastructure alone is not really enough to facilitate our behavior change. But also we could see overcrowding in the hand washing facilities that were provided. So the facilities were not enough. Okay, you look at maybe just a bucket with a tap, maybe for the whole classroom, and that could not really support, especially when the learners are coming from break and they are going back into class. They were encouraged to wash hands, but that was not enough, and that resulted into overcrowding, scrambling for them to wash hands and go into classroom. And you could see some vandalism happening, like what we can see here. In the school environment, which was not good at that time. So in order to respond to this, we piloted the group hand washing facilities in the schools. What we tried to do was to come up with the hand washing facilities that are not really high, are not expensive, but something that can be even sustained at school level. So we piloted an example of what we can see in these two pictures here, whereby learners can wash hands, a number of learners can wash hands at the same time. But during the piloting process, we also learned quite a lot, that much as it may provide that response so that it minimizes overcrowding and all other issues, we noted that there was some challenges, for instance, refilling of the bucket, because it was really, the water was getting finished very quickly because of the demand that was there. But also for safety reasons, the school management would ensure that the hand washing facility is always taken inside at the end of the school session and then brought back on the next day. And this required the reconnection and disconnection and that affected its effectiveness and resulted into more leakages happening, and that was really difficult. So much as it could be something which may help, but it also has a number of challenges that we may need to consider if we may want to go that direction. We compared this with the other group hand washing facilities, like what we can see in this slide. These are the group hand washing facilities that have been promoted by mainly UNICEF in primary schools. But as we can see, this is really high-tech kind of group hand washing facilities. They're really good. But you look at the cost now and the how many schools do we have in the country? And can we afford to provide such kind of hand washing facilities for all the schools? The answer likely will be no. But also to maintain maybe pumping of water from the ground into those tanks, having the solar technology in place to provide energy for the water. It's a good technology, but it's not cost effective in the long run. That's why in our research, we are trying to find alternatives to such kind of high tech, whereby if we have such kind of alternatives, then the schools should be able to manage by themselves rather than relying on the same partners who provided such kind of facilities. So as we were learning through the process during the time of COVID-19, we noted that we really needed to intensify that kind of hygiene promotion activities whereby the learners should be actively involved. So we're talking of demonstration here to show the importance of maybe washing hands. Why we did this is because we noted that the schools were having hand washing facilities. Some of them even had soap, but they were not washing hands. So maybe the issue is, do they really appreciate the importance? How can we motivate them to wash hands? So we had to bring in a number of activities just to demonstrate the need for them to practice hand washing. And most of our activities that we tried, and they worked out quite well, were maybe games like what we can see here, the mud ball game, the paper game, all these really worked well. This is in relation to what Natasha presented, that WaterAid is also trying to promote. But what we were trying to do was to try and use local available resources so that the schools can even do these things on their own, just to minimize the cost, and also looking at issues of sustainability. On the same vein, one issue that we noted that affected use of the available hand washing facilities was the positioning of the hand washing facilities, like what we can see in this photo here, where the hand washing facilities were positioned way low below, and it was difficult for the learners to practice the behavior. But if you put them on a higher position, then you could see that it did improve. So these are some of the small issues that as implementers, as government, may really want to look into if we are really to promote hand hygiene in schools. And we noted that some schools were taking the initiative, using the learners themselves through their life skills subject that they learn, to really even provide platforms for the positioning of the buckets with a tap as hand washing facilities, to ensure that they have a proper platform where they can practice the behavior, and they were really motivated if they were able to do that. So it's like using local available resources to promote the behavior, especially for the schools that are in the rural areas in the country. One issue that we noted, and this is also related to the government statistics, is usage of soap or availability of soap in schools. It's always a challenge throughout. So we have seen government and partners trying to improve availability of soap, but by maybe encouraging school management to make soap. But for this to be sustained, what we have learned two major issues here. The first one is access to the ingredients that are needed for soap making is a challenge. For instance, they have to use caustic soda, which is not really easily available in the rural areas. But also when they are training schools to be making soap for hand washing, they will always assemble a group, could be a committee of volunteers surrounding this particular school, but to sustain this group to continue making the soap becomes a challenge. And this requires further exploration. How can we sustain such initiatives? In relation to soap, one thing that we noted, especially during COVID-19, we could see government and partners providing soap and the buckets that I've said in schools so that we control the pandemic. But once you provide soap, and most of the soap that was provided were in form of a tablet or a bar soap, if you put it at the hand washing facility, by the end of the day, the soap is gone. So there was really a high theft of soap that was being placed in the hand washing facilities. And we could not, the schools or the government could not manage to provide maybe liquid soap, as we can see here. So in one of our piloting, we tried to provide liquid soap, but what we did was to turn the tablet soap that we see here into a liquid soap that we see in this particular photo. So we were turning this soap, shredding it into pieces and then mixing it with water, coming up with a liquid soap. So if you have a liquid soap placed on the hand washing facility, storage was minimized. Because I mean, it's difficult for someone to take it compared to just carry a tablet and went away with it. So for the schools that were using this approach, it really promoted availability of soap in the hand washing facilities. And it's a good initiative, but the schools cannot afford the liquid soap. So maybe this could be some of the initiatives that may need to be piloted further and even included in our interventions if we are to ensure that soap is available in schools. Apart from the COVID-19, we are currently also implementing research with funding from the NHR, whereby we have a number of partners, including the government in this research, and it's being implemented in schools. But what I can say from this research is the overarching aim is looking at a number of issues, but one of the components we're looking at improving WASH in schools, which the study is being implemented in 2 districts, urban and rural. And from the formative research that we have done recently, that is in Mchinja and Blantyre, we have noted that we don't have major differences between urban and rural schools in terms of sanitation and hygiene challenges. So we almost have similar challenges. What is this telling us? It is telling us that if we are to come up with interventions, we may not need to come up with completely different interventions for the urban and for the rural. Should be maybe almost similar interventions. But also hand washing practices still remains low, especially hand washing with soap still remains low. So much as there are alternatives to improve to improve availability of soap, like soap making, how can we improve that to improve access to soap in the schools? These are some of the questions that we may need to explore further as we want to improve availability of soap and in the long run, improving hand washing with soap, which is recommended by the WHO and others. Presence of sanitation facilities is good, as we have seen from presentation from the government, high coverage of improved toilet facilities. But the challenge is, what are the conditions of those toilets? Really, most of them, they are not in good condition. I would have shown the figures here, but maybe in the interest of time, I will not be able to do that. But we have learned that most of the schools and the toilets are not in good condition. There's also some level of open defecation happening in schools despite having toilets. More especially if the toilet condition is not good, it forces the learners not to use the toilet, but they will just use maybe behind the toilet and help themselves right away there. So at the moment, we're in a stage whereby we are trying to co-design interventions which may try to improve some of the behaviors that we have learned in the school setting. We hope maybe we can have a breakthrough through the co-designing that we are about to start at the moment. But in addition to that, last year in 2024, with the funding from the Scottish Funding Council, in collaboration with Strathclyde government and WASHTED, we had a convening event whereby we wanted to learn more on how can we improve WASH implementation in schools. And with this one, we learned a number of issues, like we noted that there is limited access of WASH guiding documents. We have seen that WaterAid, for example, has supported the government with some guidelines. The government has developed the school WASH guidelines, but from the rapid assessment that we have done, we have seen that most of the schools they are not aware of some of these existing guidelines, or if they are aware, they don't have a copy of these guidelines, or else they don't even know how to use, or if there are challenges, how can they address, or whom should they approach maybe to resolve the challenges that they are seeing in terms of implementation. And that's really very important. So it's like developing guidelines or having guidelines is one thing, but turning these guidelines into practice is another issue. We have seen that there's numerous WASH standards, guidelines by different implementers, especially pertaining to school WASH. So each partner would just decide to develop a guideline and then they would use it in their project, which really brings some confusion in the process. So what we are looking at during this convening event is to say, how can we harmonize the process? And the question is still there, so that if we have a partner coming into a district, they want to implement WASH interventions, they should use what has been recognized by the government. We have WASH standards in schools, but some partners are not using those guidelines. They will develop their own. So where is the gap? And how can we improve that particular gap? We noted the issues of coordination challenges among WASH implementers. So you see that maybe implementer X is implementing something similar to what Y is doing, but maybe in different districts, for example, but they're not sharing the notes. You could see duplication of efforts within the same district, and these partners even sometimes not even trying to learn what others are doing so that they improve the practice in this particular school. So there's minimal coordination, and maybe it requires attention of the government maybe to really try and bring all these implementers together so that we minimize and we try to maximize the limited resources that we have. And also, importantly, limited community engagement whenever we're having WASH interventions. We have seen partners trying to engage the communities, but not to the expected kind of engagement. In the long run, you develop interventions which may not really respond to their needs. So that's really something important. We are doing research at the moment in the early childhood development centers. As we have seen from data from government, we don't have a lot of data from these settings, but these are the preschool settings, okay? It shows it's a neglected area. We know that WaterAid has supported government developing the guidelines for this setting, which is really good. So at least there's a starting point, but it still requires some level of awareness. We still need to explore more so that we start having data and we even improve the practices. So at the moment, with support from the Rickett Global Hygiene Institute, we are carrying out a study in these settings. And one thing that we are learning from this study is the practices that are surrounding food hygiene. Because most of the learners, when they're in these preschools, they're given food, mostly in the form of a porridge. And what are the hygiene standards in relation to this? Even the feeding environment where the learners are sitting when they are eating. Look at access to water for drinking. These are all gaps that we are learning from this, and it requires some kind of design interventions to improve access to WASH in these settings, which at the moment is generally neglected. Most of the government partners, when they're implementing WASH in schools, focuses in primary schools, leaving out the preschools. But we know that the preschools are really young children and they are vulnerable to all these communicable diseases among us, surrounding us. From the SHARE project, which implemented with funding from the FCDO, we had a number of components pertaining to WASH, but one of them was to do with menstrual hygiene. And I just echo what Natasha already presented, that this is an important outcome, and it affects education outcome if it's not being given a priority. And what we have learned from the SHARE project, mainly we were looking at issues to do with the affordability of menstrual hygiene materials or products, poor disposal, and also lack of attention on sanitation facilities, especially provision of the changing rooms, which Natasha mentioned, lack of standards protocols to regulate the quality of menstrual products, but importantly, minimal involvement of men and boys in menstrual hygiene-related initiatives. So whenever they're having such kind of initiatives, it's only girls and maybe women getting involved. But in the long run, it brings a lot of challenges in terms of acceptability of menstrual hygiene related issues among the other gender. And it requires that kind of harmonization has to be emphasized if we are to make progress. Otherwise, it will remain a challenge amongst our girls in the schools. So in conclusion, what I can say is co-designing of school WASH interventions is quite important. More especially saying that we really need to involve the community themselves, the schools themselves. What do they really want? These are the challenges. They should take a leading role rather than we impose what needs to be done in their schools. But also we need to look at what is affordable based on the materials that they have. School hygiene intervention should be practical, participatory, and interesting. So we should move away from the kind of education approach whereby you just stand in front and tell learners, change your behaviors, do this, do that, but they have to do it themselves. Bringing in those interesting activities, those that are low cost, and then they try to implement it. But importantly, if such interventions are incorporated in their daily activities would be quite important. But also emphasize on local available resources and need to have measures to sustain availability of soap in schools need to be considered, as I've already explained, but also issues of group hand washing facilities are essential if we are to make progress. Thank you very much for your attention. Over to you, Tracy. Thank you.
Thanks, Kondwani. That was a real plethora of different research areas and things that WASHTED are working in. So thanks. And I know some of the team are also on the call today. So I'll invite some comments and things from them in just a moment. But I'm just conscious that we've been joined also by Albert Msaka from the Ministry of Education, who's the WASH officer there. Thank you, Albert, for making time to come along and join us today as well. So I'd like to just give the opportunity, Albert, if you wanted to give a little perspective from the Ministry of Education on WASH in schools for 1 or 2 minutes before we go into questions and answers for the wider group.
Hi, everyone. Like you have heard, apologies, I've joined late. I think I had issues in about connectivity. I'm sure you're able to hear me. Am I audible?
Yes, perfectly. Thank you.
Okay. Thank you so much. I'm very happy to be part and parcel of this meeting, though I joined late. It's really an eye-opening regarding WASH in schools programming. I appreciate so much for organizing these kinds of meetings. I think they will really help in improving WASH programming in schools, which is really, as you have just seen from the presentations, we're really struggling to improve a number of issues. So maybe for now, I just want to hear more from those that are on the ground and learn from them and see whether the information that is coming in through several research that we have had here that took place in schools and see how those results will be able to help us at policy level to see if we can be able to improve our policies so that it should be evidence-based when we are coming up with programmatic issues regarding WASH in schools. So it's true, I think most of what has been presented is a true reflection of the challenges and that we are facing in schools. Of course, as government, we're trying our best, but as you might have seen, there are so many challenges that are being taken on board. Just to comment that indeed, yes, the Ministry of Education in collaboration with Ministry of Water and Ministry of Health and all the relevant stakeholders in WASH in schools programming, we developed the WASH standards for primary and secondary schools. But just to let you know that the standards have not yet been launched and they have not yet been printed out because we are still looking for resources to be able to print copies and organize launch and also do dissemination in various schools across the country. So yes, we haven't disseminated the standards yet because we are looking for resources to do that activity. Maybe for now, I leave it here, but the ministry is very open to engage different stakeholders that are partnering with the ministry in improving WASH in schools. would love if different stakeholders should be coming to the ministry and meet the PS for education, just to bring to their attention about the situation that the research that is taking place in schools has brought about, but also different interventions that different partners across the country are doing. And also the PS should know the donors that are supporting and investing heavily in improving WASH in schools, including menstrual hygiene and behavior change. And also, as you know, we link all this to what is already in the curriculum at different levels of the primary and secondary education. So thank you so much for organizing such a brilliant sharing of information. As a ministry, we really appreciate, and we're just wishing each one of us good collaboration moving ahead. Thank you so much for giving me this opportunity. Over to you.
Great, thank you, Albert. And I'm sure there'll be some members of the audience getting in touch, and Albert's contacts are in the chat if you're looking for them, but getting in touch to meet with the PS about this issue as well. And thank you for that offer as well. Rosanne, I saw your hand flashed up there and then you took it away. Did you want to ask your question out loud to the wider group? And if you can put your camera on while you're talking, it's great for everyone to be able to see you if that's possible.
I'm in the field, actually, in the schools. Okay, thank you very much. I just want to pose a question or get clarifications. I think in the formative study which we just conducted in the schools, we observed that in the urban schools, there's high rationing of water due to the high bills. And I think if I heard well, it's in Natasha's or your presentation, you mentioned about this issue as well. So I just wanted to know that what is the Ministry of Water as well as the Ministry of Education doing? Because it seems that we are all aware that the costs of water is high already in the schools, yet they don't have adequate funds to support them. Thank you.
Thanks, Rosanne. I see Albert's put his camera on, so I think he's ready to answer. Oh, no. Oh, you're unmute. You need to unmute though, Albert.
No, because I saw the instruction there on the chat to say when you're about to speak, you need to put your camera on so people can see you. So apologies, I've put it late, but I will switch off shortly. I just wanted you to appreciate the voice and the face so that we can link. Thank you so much.
Always appreciate your face, Albert. And I think, I don't know, Albert, if you want to say something about school development funds. I know that's something we've talked about in terms of paying bills. I think Alexander also alluded to it in his presentation earlier about the challenge of trying to get school development funds to prioritise paying for water and some of these WASH issues.
Sorry, I didn't get the question clearly. Would you just repeat the one who asked the question? Over.
No problem. So Rosanne had asked the question about how our Ministry of Education and Ministry of WASH supporting schools to be able to pay the bills, like the water bills, especially for the urban schools, are a big challenge for them to keep the water supply on. So is there a way that we're looking at how we can try and tackle that challenge with the high cost? Not an easy question to answer, I understand. But give us your thoughts, Albert. I know you always have them. You're muted.
Maybe Minister of Water should start, then I'll be second.
Well deflected. Alexander, do you have any comments?
No, I think as Tracy said already, I think it's a difficult question. But as already alluded to, that issues of WASH are mainly from perspective of Ministry of Education. They're not really given a priority. As you suggested, I think we need to find a mechanism on how we can be supporting school in terms of those that are connected to piped water, which has been a problem in most of the schools. You would find most of the schools, I think, water is disconnected. So I think we, as the two ministries are struggling, maybe to get a solution, but we can sit down together, together with water boards and other ministries to make sure that we find a solution to that problem. Thank you.
Thanks, Alexander. Maybe, Natasha, I don't know if you want to give a bit more detail on WaterAid, how that was tackled in the schools where WaterAid was implementing the project as well.
Thank you so much, Tracy. So for WaterAid, we had to come in because I think considering issues of the COVID-19 as well as the cholera outbreaks. So this was just our way of trying to help government to respond. And although we acknowledge that this is not sustainable, because we need government to come through with these better strategies. And we also have been engaging with the water boards for maybe at least subsidizing the rate that they use maybe for the schools, because that's what is also proving to be challenging. So probably we may need to have a collective voice from the Ministry of Water and even other WASH players and those in the education sector, so that we can lobby for that. Thank you, and over.
Can I come in now?
Please feel free.
Okay. Thank you so much. Yes, I think we need to accept that I think issues of payment of bills is quite a challenge in most of our primary schools. However, for example, government is trying its best to assist, especially if we reflect back in when we had COVID-19. Most of the bills in schools, I think the government made an initiative to pay so that the schools should have water, as water was very crucial in preventing the further spread of COVID-19. I think one critical issue to note in this case is that there is need for all of us to join hands in lobbying for government, for more funds from government to help payment of these bills. So would request our colleagues, would we engage, moving forward, we need to engage more our sister ministries like Ministry of Water and Irrigation, Water and Sanitation, but also Ministry of Health and institutions like WASHTED and other advocacy organizations regarding WASH. We need to come up with a strategy on how best to engage government, Ministry of Finance or Treasury, to have with us evidence that is going to help us justify why we need further, increased support in the field of WASH. As you know, there are always competing priorities when it comes to government funds, so we need to come up with a justifiable evidence as to collectively and try to negotiate to lobby for more financing. Again, we also need to take on board water boards, whether along the water board, Brandwood board, to see if there can be a way of helping, especially urban schools, on how best the pricing mechanism. They should deliberately maybe come up with a pricing mechanism that would favor learners in schools. In most of our schools, we have very few water points. Sometimes you look at a school with a population of maybe over 3,000 learners, but just having maybe 1 tap or 2 taps. So there's also pressure in terms of water points. But I think moving forward, we need to strongly improve our collaboration. As government, we know there are several stakeholders out there that are doing their best to assist the Ministry of Education in improving WASH situation in schools. But I think our major challenge has been collaboration and coordination. We are working in silos, so that is also creating, we're not putting together all the efforts that are being done there in schools, but also all the finances that are being invested. If we can collectively justify how much we're investing and how much is the gap, and then lobby to government, I think, I believe there will be a very positive development. So let's continue engaging and let's continue sharing ideas on how best we can try to assist. During this period, we know our resources are very minimal to come by. Over to you.
Thank you, Albert. Sounds like an important role for WESNet to help with coordination. Alexander, you have your hand up. Can I hand over to you if you don't mind putting your camera on as well? and then I'll come.
So I just wanted also to add, apart from maybe having water disconnected, water for drinking disconnected, but I think in most of the urban schools, initially, schools had the toilets that were flush toilets. But most of them, when you go into schools, you find that they no longer use those flush toilets because water was disconnected. I was just thinking on how best can we do this, because we're talking about moving on the service ladder to safely manage sanitation. So if we remain in this situation where water is disconnected and people and learners cannot use flush toilets, we are wondering, where are we going? So we need to indeed find a mechanism that we make sure that all the time the schools have water running. Thank you, and over.
Thanks very much, Alexander. Yeah, and I think it just helps to point out the complexity of this challenge as well. It's not just the case of providing the infrastructure and they will come and things will be better. It is the enabling environment and the systemic change that needs to happen and the sustainability of it as well. Blessings, you have your hand up. Do you have a question for us? And if you're able to turn on your camera, that would be great.
Yeah, so, well, okay, so I understand the inclusivity of these sanitation facilities in schools is also a challenge here in Malawi. So I also need to understand from the government, especially from the ministry, on maybe the standards which are being developed. So how are you like incorporating this issue of inclusivity of these sanitation facilities in schools, considering those with mobility challenges? Just want to understand on that part. Yeah.
So maybe we could ask that one to Alexander, you'd mentioned, or and Albert, you'd mentioned the new standards that are coming out for primary schools. So in what way are they covering issues of physical disability and accessibility?
Yeah, all right. All right. Thank you so much, Blessings. As presented on the presentation, already the government is making progress in making sure that the facilities are inclusive enough. So for the standards, we'll make sure that all those issues are included, so that all those people developing sanitation facilities schools, they should consider inclusivity. And that one is going to be a must, that we make sure that all those standards include the issues to do with the inclusion. Thank you.
Thanks, Alexander. And then probably looking at time, just the last question, Velia, if I can hand over to you.
Thank you very much. And I've enjoyed the presentations, especially when the presentations are showing both the formative research, which is feeding into the interventions. In other words, we are seeing interventions that are evidence-informed interventions, which is very good, But my question goes to Dr. Chidziwisano, especially where you informed us that the formative research revealed that when bar soap was used in school, we had the problem of that soap being stolen. Then later on, when liquid soap was introduced, at least that one proved to be staying, it was not getting missing. So in terms of sustainability, did you find this to be sustainable, considering the poverty levels in Malawi, since liquid soap is a bit expensive compared to the bar soap, and yet the bar soap is continuously getting missing? So I would like to get more information on that, but I've enjoyed the presentations. Thank you very much.
Thanks, Velia. And Kondwani, maybe just to re-explain about the alternative liquid soap for Velia. Are you able to do that?
Yeah, thanks very much. Sorry, I will not be able to put on my camera, but what I can say is alternative to the liquid soap is because you cannot be buying the liquid soap that we know from the shops, very expensive. But we have to encourage the schools. They can turn the bar soap into liquid the way we did it. And there is a way on how that is done. And that has proven to work. It doesn't affect really the effectiveness of the soap when it's being used. So that should be the way to go. We can even use the small pieces of soap that have remained after using, turning it into very, very small pieces, and then putting into a bottle of water, dilute it, and then it forms this kind of liquid soap, and it's used, and it minimizes theft of soap in schools. Thanks, and over.
Great, thanks, Kondwani. And I said Velia was last, but I can't say no to Natasha having her hand up. So Natasha, over to you.
Thank you. Just a quick one. I wanted to say that in terms of the standards, like the one that we supported government for early childhood development centers, we also supported them in developing technical designs for the infrastructure. So it already, the infrastructure is inclusive. We involved a number of stakeholders so that we make sure that they are accessible. Any infrastructure developed is as accessible by anyone. Thank you, and over.
That's great. Thank you, Natasha. And I think maybe just that's another great point. Natasha keeps setting me up perfectly today. Just a great point to say there's been reference to a number of different guidance and guides and standards today, which we'll try and share in the links that you'll get from attending the event. So there'll be the recording of the event, but also links to these different items. I'll maybe ask, while we're here, for Alexander or Albert to help us with maybe even just an electronic or digital version of the primary and secondary standards that we can put on there as well, alongside the technical guidance that Natasha mentioned, the ECDC guidance as well, and links to some of the research as well that Dr. Chidziwisano has referred to in there. I'm going to close off the kind of WASH in schools part of the session, but just to say it's been really incredible to hear the depth and breadth of the different work that's going on, and a real reflection of the complexity of WASH in schools. It's not just that infrastructure or even just nudges for behaviour change. It is about that whole system approach that we need to WASH in schools, and very importantly, about making it appropriate and accessible within the context in which it's set. And that does need us in perfect setting within the Scotland-Malawi partnership and sister organisation, the Malawi-Scotland partnership, of working in collaboration with one another, helping to know what each other are doing, how we're doing it, and what we can learn from that to move forward. And I think a great call to action for us all as well, from Rosani, about what can we do to lobby and support decisions around school funds, but and their use, but also lobbying for that support to maybe reduce, for example, water costs for schools as well. So from my side, a huge thank you to our three speakers, to Alexander, Natasha and Kondwani, for the time and effort you put into preparing for today and coming along and sharing your expertise. I'm sure you'll be hearing from some of the colleagues on this call to know a little bit more about. And I will hand over to Chad for the rest of the thank yous and what's coming next for SMP.
Now, those of you online, thank you very much for joining us. You'll see in the chat box, there's some links to our upcoming events. So we encourage you to join us in the future at one of our upcoming events. And if you are not a member of the Scotland-Malawi Partnership and based in Scotland, then there's a link there to please join us. It was just a final thank you. Obviously, Tracy has thanked the presenters for their time today, but a special thank you to WaterAid, one of the SMP members, for hosting us today here in their offices. Although we're a small group in person, we were joined by lots of people online, and a far majority of our colleagues in Malawi. So thank you very much. You will receive a link to the past event page for this with all the resources, the PowerPoints and the other reports that have been shared. So you'll get that in your inbox. And there will also be a link to please complete a very, very short survey on how we can improve these meetings, which is important for our reporting as well. So final thank you to Professor Tracy Morse for pulling this meeting together. And we wish you all the good rest of the week. Thank you very much. If the presenters, I've asked you in messaging, if you could please stay on the call. And thank you to the rest of you for joining.